Bradshaw here with ChiroCynergy. Today we're talking about chronic neck pain. And that can be really caused by three things. Well, really four, but what we're going to be treating today with this particular video is three different problems. And those are facet problems, disc injuries, and degenerative disc disease. And let's talk about those so you get an idea of what is going on with this. Here is a model of the spine, okay? We have discs, which are the shock absorbing pads between each vertebrae. And the vertebrae are these white bones here, here, and here, okay? If you were to tilt this forward, so you can see this from a bird's eye view, looking down from the sky above, you see the disc kind of looks like a jelly donut, okay? There's a tarred ring, and then there's a soft jelly center, okay? And this is a healthy disc, and this is what it should look like, all right? As we get older, these discs tend to get a little bit shorter. That's just part of the aging process. They're 60% water. We tend to dehydrate as we get older, and these discs get shorter, and we therefore lose some height in our spine. But you could have an injury much younger in life in which you tear the outer ring of this disc. Okay, and the jelly center can push through to the edge. That's called a disc bulge. All right? If pull this vertebrae away here so you can see a better example of a disc herniation, where the jelly center pushes beyond the edge of that ring, and now you got this disc material floating out beyond the edge of the disc. That is a disc herniation, also known as a disc protrusion. Okay? That is a problem because it pushes up against a nearby nerve. These yellow tubes, there's the nerve going down your left arm, let's say, and this tube right here is the spinal cord. If that disc injury pushed back onto the cord, it might affect not only your arms, it might be going pain down your back and down your legs. Okay? So those are disc injuries that can occur from car accidents, from a slip and fall. It can even occur over time just because you have bad posture. And eventually that disc material oozes out through these injured discs, these poor posture discs, and you end up with these problems. Okay? So that's one. The next thing is you could have degenerative disc disease. So you can see as we get older, the discs tend to get a little bit thinner, but it can go all the way down, it can shrink down to the point where the disc is almost non-existent, right? Where these bones are almost bone on bone. That's called degenerative disc disease, and this is a severe example of it. This would be just a mild case of the beginning of degenerative disc disease progressing down to this level, okay? In this case, the disc material is squished down, you have very little range of motion, and it becomes very painful because there are nerves in these discs in and around the jelly center and around the edge. And those nerves, as the bone above pushes down onto it, becomes very painful. So that can be causing problems for you too. The last one is a facet joint problem, okay? So this is for the front of the spine. We're gonna flip it around, and you can see the back. And the vertebrae above and the vertebrae below come together here to create this vertical gap right here and this vertical gap right here. Those are called facets, okay? And when you extend your head back this way, you get compression in those facets back here and here. And if you have a lot of that irritation over time, the facets can become arthritic. And instead of being these nice smooth edges, they look like pieces of cauliflower as the body lays calcium into that joint due to the chronic irritation and chronic problems there. And over time, you can get it to where those facet joints are really locked up and you don't have a lot of motion. You see these people when they go to turn their head and they can't move, they just turn their shoulders because they can't turn their head. Facet arthritis has always set into these patients. So today's video is designed to show you how you can treat those three problems, any one of them or a variety of them, combination of, using what's called a traction device, all right? And here's what we use in our office. So let me set this down, and I'm gonna bring this over here. This is a state-of-the-art cervical traction unit designed to help treat those three things, okay? And we're gonna show you how to use this at home, and very likely if you have this video and you're watching it now, you've been given this, so you bought this, and you're gonna be using this to help treat one of these problems in your neck, okay? So here's how we're gonna use it. You're gonna just lay it down onto a hard surface. You can do it on the floor, you can do it on, you can even do it on the bed because this is firm enough, but I recommend a fairly, firm surface. You don't wanna be like laying on an inflatable bed or something like that. You want it to be fairly firm, okay? Now the device itself is designed, I'm going to step over here so you can see what I'm talking about. The device itself is designed to stretch this way, okay? So there's two different bulbs here for the neck, all right? And so one of them inflates and pushes the shoulder pieces up this way. It's going to actually separate your shoulder from your head, making you taller, all right? So watch these accordion pieces right here. I'm going to press on this bulb, and you will see as these gaps open up and get wider and wider with each squeeze of the bulb, okay? So your shoulders are resting under here, and I'll give you an example in just a moment so you can see it. But just know that there are two bulbs. This bulb is designed to extend your head up this way and make you taller, okay? And there's a little button right next to the bulb. If you push it, you'll watch this go back down. And the air escapes the bladder, and then these can compress back together, okay? So that's what one bulb does. The other bulb is back here, and it will inflate from underneath and push this tip the head forward. So for some of you who don't have great posture, if you look at me from the side, if you have good posture, your ears should be right over the sides of your shoulders. Chances are, because you have to use this unit, you don't have great posture. And if your head is out in front of your shoulders to varying degrees, you might be standing more like this. It could be very difficult for you to try and lay your head flat back on this while you're laying on your back. Your head might not make it back this far. So that's what this bulb is for. This other bulb is going to inflate and push this headpiece forward. Another good example might be in your own vehicle, the car that you drive. You might have that headrest kind of tilted forward so that your head can actually be resting back against something, okay? When you're driving in your car. Sometimes your head just can't get back there far enough, so you have to tilt your headrest forward to meet it. The same thing here with this traction device. What you do is you squeeze this bulb, and you will watch this. If you get down a little bit lower here so you can see it at home, you'll see that this piece is going to raise up off of the bed. Do it from this side so you can see it right here. And you can see this gap right here getting bigger and bigger and bigger. That might feel much better on your neck laying in this position. So that is what this other bulb is for, to make sure that your head is not tilting back quite as far because it hurts. We want to get the head in a comfortable position before you use the other device to get this to stretch up, okay? But for me, I don't need to do that. Again, you want to release the air in this. You push this button right here next to the bulb. You can even hear it escaping. And now the headpiece is nice and flat again, okay? So I'm not going to use that because I don't need to use that. But I am going to stretch out my neck, and here's how it works. I'm going to get up on here, get onto your back. Look, if you come around to the front here, you can see from the top, come right here. These supports are right underneath my skull, but over the top of my shoulders. So they're kind of nestled in between my skull and the top of my shoulders. I'm in perfect position right here. I want you to bend your knees. So go ahead and back up so they can see that. I want to make sure you bend your knees. You don't want to irritate your low back doing this. You're going to be laying here for about 15 minutes at minimum. So in doing so, keep your knees bent. All right? And take the bulb like we spoke about earlier, and you're just going to start pumping it up. And I start to feel that really starting to stretch my neck right there. And it's pushing my head this way. Now, you want to get this to a point where it's pulling and stretching, but it's still comfortable, okay? So if you're thinking, I kind of feel it, you're not there yet. Keep going. And for me, that's right about there. It's really stretching my neck, but it's still comfortable. I can handle it, all right? If it becomes painful, you've gone too far, you need to back off. You need to let some air out of the bulb, right, using this little trigger button right here. Now, I got it up to the point where I don't want to go any higher. I'm going to keep it there, and I'm going to hold it for a count of 30. So I'm going to count to 30. 1, 2, 3. When I get to 30, I'm going to release all the way back down. Okay, so use that trigger button, let the air escape, and then you're going to do it again. Go right back to where you were before. For me, it's about 15 squeezes there, right there. Hold it again for a count of 30. 1, 2, 3, up to 30, right? And again, release. And you're going to repeat this over a 15-minute period. Okay? So what we're going to be doing is we're going to be taking those compressed discs and we're going to be stretching them open, and then we're going to let them relax. And we're going to stretch them open, we're going to let it relax. Just like an accordion, the instrument will suck air into the instrument. This is sucking blood into your discs, water via the blood flow into the disc, and making those disc spaces open up and those facet joints open up. And this feels really good for somebody who's got some chronic neck problems. So you do this for 15 minutes, okay? So 30 seconds, hold it in that spot, and then you're going to let go. And once the air is all the way out, do it again. Repeat, rinse, repeat for 15 minutes, excuse me. Once you've done that for about a week, you can increase it to 20 minutes. Then after another week, increase it to 25. The goal is to get to 30 minutes of doing that. That will make a difference. You will take years of degeneration and problems in your spine, and you will release that, and your neck will feel like a whole new neck. Okay? So have fun with this, but be safe and make sure you use these bulbs like I've shown you. Have fun.